share a little bit about myself with you today. I am a pre-nursing undergraduate student, and I'm really looking forward to applying to a nursing program here at Utah State in spring 2017. I'm a multi-ethnic person. I am a member of the Cherokee Nation. I am Mexican and I'm also Dutch. But more importantly than my genetic makeup, I am ambitious, I am responsible, and I'm resilient. In my youth, when people would ask me what I wanted to be when I grew up, I would always answer veterinary because I love animals and I have an innate love for animals. However, from the time that I was 3 years old, my mother has had extensive medical challenges, and I grew up around doctors and nurses my entire life. I've been to countless doctor's appointments and have just been in that environment, surrounded by trauma and stuff like that. So, I believe that in life, when you find your purpose, you find your passion. And both my purpose and passion came to light in 2009. After my mother's 6th abdominal surgery, she flatlined, and that event was I remember that vividly. The nurse Michael, ran in and he headed the resuscitation team that brought my mom back. So it was in that moment, that event, that really shifted my professional goals from becoming a veterinarian to becoming a nurse. If not for the efforts of those medical professionals, my mom would not be here with me today. I'm very, very glad for that. Also in that event, I become keenly aware that nurses not only nurture and care for the patient, but they also care for the family too. What would I be without my mother? As a future nurse, it's my goal to administer to patients as well as families and preserve the home and family. So today when people ask me what I want to be, and positively answer that I'm a nurse, confidently. After speaking with Mr. Peterson and Mr. Becker, I've come to understand that there will be an opportunity for a scholarship. The mere thought of having an opportunity to have a scholarship is just a positive one. I'm a very goal-oriented person, and I've strived for academic excellence my entire life. I wish to achieve a higher education without living in debt. With financial support, it would surely boost the possibility for me to attain that goal. Without financial aid, my dreams of becoming a nurse would fade away quickly because I don't possess the means to fund my own education. A lack of financial assistance would really inhibit me from fulfilling my purpose, which I found to be nursing. And my father always tells me the saying that wisdom is priceless, but education is costly. So I really will have relief from such a financial burden and hardship so that I can proceed in having a successful career in nursing. Thank you so much for letting me share today, and I'm very thankful for the opportunity. Thank you.
I want to thank all of you for being here today. We have a long history with Intermountain Health, with some of our other programs in the college. For many years, we've been graduating speech-language pathologists, audiologists, psychologists, and other health education and healthcare professionals. And our partnership with Intermountain Health has helped us to really provide excellent training opportunities for these students, and at a level of excellence that we could not provide without your partnership. So we're really grateful, and have been for many years, for this partnership. When the provost a couple of years ago asked me if I would be willing to take the nursing and health professions program into our college, I didn't hesitate to say yes, although I ran into a few people later who said, "Nursing in your college? Are you crazy?" I'm not sure why they said that. They said it's a high-maintenance program, but I don't believe it. But I didn't hesitate because we have such a commitment to the health professions in the college, and this is one more way for us to be able to serve the people in this community and to be able to train students in professions that matter. And Amorae, your story is just one example of how much it matters. I was thinking of my little story of my blender mishap 2 weeks ago that landed me in the ER, but your story is a little more important. And I think about the times when family members had been in the hospital and needed the support of great nurses, and those people have been there providing a level of service that makes such a difference for families. And so welcoming nursing into our college was an easy decision. And we're really excited to continue our partnership with Intermountain Health in training our nursing students. And I have seen too in the last year as a board member at Logan Regional Hospital, the level of excellence that's expected at Intermountain Healthcare facilities. And so I'm really proud for us to be able to join in that partnership. And when we have our new clinical Center for Clinical Excellence, which is expected to be completed in November of 2017, we'll be able to offer to you as partners facilities that you can use for professional development, a state-of-the-art nursing simulation lab, programs that you can offer to the community in healthcare areas like diabetes prevention or childhood obesity prevention. So I think as partners, we each have a lot to gain from the relationship that we have, and I'm very grateful to have that opportunity and grateful to be here today. Thank you.
Well, it's good to be here with you today. My name is Neil Perkes, and I'm the nursing administrator at Logan Regional Hospital, and I very much appreciate just a few moments here to speak to you today. Before I begin, I want to mention that both my parents are native to Cache Valley, as are our family. Both my parents are Aggies. I have 8 children total. I've got 5 children and 3 stepchildren, and 4 of those children have either graduated or enrolled at Utah State currently. I've got 2 sons that are both returning home in July from serving missions, and they are both enrolled at Utah State. And I'm sure our 2 in high school are going to be Aggies as well. There's a very strong chance of that. So we are definitely an Aggie family. It's a real honor to be here today and participate in this program. Our mission at Intermountain Healthcare is helping people live the healthiest lives possible. And key to that is our registered nurses. They are very most important in helping us achieve that goal of living healthy lives within our hospital and our hospital family. For many of our patients, our nurses they have more face time with the patient than most any other caregiver. And so they are at the heart of what we do, and they're crucial in taking care of patients and also caring about them when they care for them. They're also vital in helping our patients feel safe, welcome, and at ease when they enter our facility. And that's a part of things that we stress, is that our patients, when they are in our facility, they very much feel safe, welcome, and at ease as we provide care for them. And so it's so crucial that we have these very well prepared and qualified individuals working with us. As of last week, we had 700 open registered nursing positions at Intermountain Healthcare. Locally, we have 40 open registered nursing positions, and so we've reached a time again where the demand is outpacing the supply. And so we are in significant need of having a good influx of continually prepared and well-qualified nurses. And so today I'm very happy to announce that Intermountain Healthcare is contributing $100,000 to the new nursing program here at Utah State University. And we really feel that that will help establish this program and provide a very good continuing connection and ongoing relationship between the university and Logan Regional Hospital. So we're very happy to be a part of that, and we value that relationship very highly. Many of our physicians, nurses, and other caregivers are graduates like myself from Utah State University, and so we cherish this relationship and hope that it continues. And we feel that this contribution will help us in providing services to our community and ensuring our community and our employees live the healthiest lives possible. And so I just want to let you know that we're very grateful for this opportunity. We're grateful for this commitment to make to this fine institution, which I love, and I'm very grateful for the experiences that I've had, my parents have had, my children have had and are having, and so go Aggies. So